Alright, so Marie here is going to show us how to use the different DME products as well as our 10 units. Okay, Marie.
Okay, first we're going to start out with the ankle brace, as we used to call it the AFO. The first thing you're going to do is you're going to pull what size, and it comes in small, medium, and large, and your best thing to do is to ask them what size shoe they wear. Then you're going to pull your proof of delivery ticket, and you'll see a spot on there that says for the recovery ankle brace, and you'll mark which size for the left or the right or even both. Okay, the first thing you're going to do is you're going to pull this out. You're going to undo all the Velcro straps, every one of them. You're going to have some up here you got to undo, and then you're going to help the patient slide their foot in it. Make sure their heel goes all the way to the back here. And then you'll just help them strap it in. And the best way to do that is to go ahead and do the top first. Make sure it is Velcroed in. And then this one is aggravating. You got to put it back in its little slot. But it's easy to just, when it's slided around, and Velcro it. The last thing I do is make sure that this is done. These are the little laces, if you will. You're going to pull them, and they go opposite sides to lace it in. And most of them will fit around the back. Now, they need to know that they're probably going to have a different size shoe, something that'll open wider, because this is kind of bulky in the back, and it's not going to fit in dress shoes or slide-ons or things like that. So most time they're going to have to either open their tennis shoe or their athletic shoe wider to slide it in. And that's pretty much all that is. This is the wrist brace or the thumb orthotics. It comes in right or left, of course. You're going to have to open it up to, what you're going to do is the laces, just put your hand in, make sure your thumb is right there at that little, I call it a triangle type thing. You're going to first put your thumb in. You're going to take a little strap and brace your thumb in it, just like that. You're going to have this little area right in the palm, and then you're going to take these other ones and you're going to pull it pretty tight as they can handle it, and let the patients know you don't want it too tight because you don't want their fingers turning blue. But that's pretty much the way it's going to be, and then you can adjust it as much as you need to make sure their thumb and fingers are secure, and it's going to look pretty much like this. Make sure their knuckles are free so they can bend their hands. Okay, and the same thing on the sheet. There is a spot for the thumb orthotics for right or left, and you'll just have to mark that. And if they get a right and a left, then you have to mark both. This is the TENS unit. This will be given out along with a spray, and you're going to be doing either socks or gloves. The socks is for neuropathy feet. The gloves are for neuropathy hands. The TENS unit, you will get it out of the case. The first thing you're going to do, which I've already done, is put the battery in. These controls right here, you can do it for 15, 30, or 45 minutes. We always try to do for 30. These controls, always make sure it's 120 and 70. Oops, back up, 70. And then you'll tell the patient the only thing they need to do when they open this up is to check when the battery goes dead, they need to replace it. It's a regular 9-volt battery. They can get it anywhere. But I always set it for 30 minutes. That way when the patient starts, he knows it's 30 minutes long. Just like the treatment we do here. Okay, you put the case back on. In the case, you're going to have 2 sets of lead wires. You're really only going to need one for the socks and the gloves because you're going to hook them both up. I'm not going to unwrap these, but they are 2 settings on here. So if you were to use both sets of lead wires, you would plug one in this side, which this button will control. You plug the other one in that side, which this one would control. Since I'm only going to use one, I'm only going to use this button. And when I'll turn it on, you'll see the green light. All right, as far as the socks go, I'm not going to put these on for sanitary reasons. You're going to plug it in, and then you can plug the other sock in the black one. When the socks go on, of course this is the top of the toe, and the sock will go right on the leg. before you do that, make sure you spray. They tell them to spray this on a light mist. They don't need to soak their feet, just a light mist around their foot and leg on both, if they're using both socks. That bottle should last them a long time. Okay, so we're gonna hook this up, and then you'll hook the other sock into this one. All right, you're gonna turn this on. It does go from 0 to 8, and I tell people, turn it on until you can feel it, and maybe a little bit more. Don't hurt yourself. Now, if their neuropathy is really, really bad, and they don't feel it, I'll tell them to go maybe to 4 and just leave it. Hopefully, eventually, between the treatment here and the treatments at home, they'll start feeling it, and then they can turn it to the way they can feel it and adjust it at home. But that's the way that's gonna go, and it's gonna be like 30 minutes. Let them set a timer, because if they're not feeling it, they're not gonna know when it turns off. If they're feeling it and it turns off, then they'll know to come back in here and turn this off anyway, because that'll save the battery. But if they don't have a good feeling, then they need to set a timer so they'll know that 30 minutes is up. And that's the way the sock goes. Now the glove is gonna go the same way, and I'm just gonna plug the other lead wire in so you know. It's gonna do the exact same thing. You're gonna plug both of them in, and when you put the glove on, you're gonna notice there's one for right, and I think it's one for right and one for left. If not, then you just put them on. One may go on top up here for the little control, and the other one may go on the palm, but it's still gonna work just the same way. And make sure they mist their hands with the spray, not soak them, but mist them, and then they'll put the glove on and do the same thing. And this box works the same way with the glove. Also, there is a spot on here on this proof of delivery for this TENS unit, and then if you give them one glove or two, just mark 1 or 2. Or if you give them one sock or 2, just mark 1 or 2, and then make sure they sign it.